Hello students, I am Dr. Nazif Mahbub, the lecturer of the Department of Anatomy at Dr. Sirajul Medical College. Today we will learn about the rest of the part of the hip bone. As you know that the previous part was taught to you by Dr. Shubhendu sir. So the next part I will be teaching you. Now, before going to the later part of the hip bone, let's review some stuffs. Okay students, now let us start the topic of the hip bone. We know that hip bone is a morphologically irregular shaped bone. Now, hip bone has three parts. They are the ilium, the ischium, and the pubis. These three parts actually meet at the acetabulum. Okay, so we can say that hip bone is divided into three parts by the acetabulum. Now, if we actually divide the acetabulum into five parts, we can see that the upper 2 by 5th part of the acetabulum is actually ilium. The anterior superior 1 by 5th part of the acetabulum is pubis, and posterior inferior 2 by 5th part of the acetabulum is ischium. Now let's study on the topic of the anatomical points of the hip bone. So first we have to say that this is the hip bone. Anterior superior iliac spine and pubic tubercle lies in the coronal plane. Ischial spine and the upper part of the pubic symphysis lies horizontally. Pubic symphysis lies medially and vertically. Acetabulum lies posterolaterally, and greater sciatic notch lies posteriorly. Let's come to our topic of pubis. Pubis has one body and two ramus. The body of the pubis has three surfaces. They are the anterior surface, the posterior or pelvic surface, and the symphysial surface. It has one border, upper border or pubic crest. Lateral part of the pubic crest presents a tubercle that is called pubic tubercle. Now, what is the attachment of the pubic crest? The attachment of the pubic crest is rectus abdominis muscle and pyramidalis muscle. What is the attachment of the pubic tubercle? Now, this question is very important for spotting. So the attachment of the pubic tubercle is medial end of the inguinal ligament and cremaster muscle. Now let's come to the relation of the pubic tubercle. The relation of the pubic tubercle is, in case of male, spermatic cord, and in case of female, it is round ligament of the uterus. Now let's come to the ramus of the pubis. Pubis has mainly two ramus. They are the superior ramus and the inferior ramus. The superior ramus has three borders. They are the anterior crest or obturator crest, the superior border or pectineal line, and the inferior border. The superior border or the pectineal line further has two parts. They are the medial part and the lateral part. The pectineal surface originates from the pectineus muscle. Now, the inferior ramus. Inferior ramus fuses with the ramus of the ischium and form ischiopubic rami. Now, the muscle attachment of the anterior surface of the pubis. The anterior surface of the pubis gives origin to adductor longus muscle, gracilis muscle, adductor brevis muscle, and obturator externus muscle. Now, let's come to the pelvic surface. The pelvic surface is directed backwards and upwards. It is smooth. From the midpoint of the pelvic surface, it gives origin of the anterior fiber of the levator ani muscle. I'm telling again, from the midpoint of the pelvic surface gives origin of the anterior fiber of the levator ani muscle. Between the urinary bladder and bones lies retropubic pad of fat. The symphysial surface of the hip bone joins with the opposite symphysial surface of the opposite hip bone, and it forms Pubic symphysis. Pubic symphysis is the secondary cartilaginous type of the joint. Now you have to remember one thing, that the pubic tubercle, it is actually a landmark for the surgeons. In the above and medial part of the pubic tubercle, if hernia occurs, it is called inguinal hernia. In the below and lateral part of the pubic tubercle, if hernia occurs, it is called femoral hernia. Inguinal hernia is more common in male, femoral hernia is more common in the female. Now, let's come to the topic of the acetabulum. The acetabulum has two surfaces or two parts. They are called the lunate surface and the acetabular fossa. The head of the femur articulates with the lunate surface, and in the acetabular fossa contains large amount of fat. Lunate surface is also covered by the acetabular labrum. It is a fibrocartilage. Acetabulum presents a acetabular notch. On the upper part of the notch presents transverse acetabular ligament. This ligament converts the notch into a foramen. This is very important to remember, that this foramen transmits acetabular branch of obturator artery and nerves, medial circumflex femoral vessels, and acetabular artery. Acetabulum is divided into three parts in fetal life by Y-shaped cartilage, and the joint is primary cartilaginous joint.